Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker with Terrebonne Home Care. Very glad you're joining us. However you may be joining us, we appreciate it. And it's really weird. I know that I'm different, that I get excited about these kinds of concepts when we get a group of people together really addressing the needs of our community. I'm very excited to have a panel of people who are doing exactly that. I want you to welcome me first, Ms. Brandy Levy, an LPC, Program Director for the Behavioral Health Crisis Walk-In Center at Stark Corporation. Brandy, thanks for joining us.
Thanks for having me.
I appreciate it. Sitting next to her, Mr. Tim Pellegrin, nurse practitioner with Behavioral Health Tesh Action Clinic. Glad that you're here, Tim.
Thanks for having me.
And we put all Tims together. Sitting next to him, of course, Sheriff Tim Saunier, Terrebonne Parish Sheriff's Office. Tim, thanks for being here.
Thank you, Keith.
Appreciate it, Sheriff. And rounding out our wonderful panel, we have Chief Travis Terrio, Houma Police Department. Chief, thanks for joining us.
Thank you.
I'm having to get used to the chief thing. It's a really good thing. In fact, I had to talk to somebody that needed to straighten him out. I said, listen, I'll call Chief Travis if I need to. And it kind of straightened him out immediately. One of the things that we know, there is a crisis. We have a mental health crisis. We have a substance abuse crisis. We know that there are a lot of issues in the area. What are you guys seeing at HPD, Chief? What are some of the things that y'all see as the challenges here with this?
Look, it's not just what we see. It's across the country. It's
Right.
It's a natural progression. It's getting worse.
Right.
24 years in law enforcement is probably the worst we've seen between the narcotics addictions and the mental health. And you put the two of them together, it's a recipe for disaster.
Right.
So, with the problems we're seeing and the problems that our mental health partners are seeing, it only made sense that everybody should come together and start working towards a common goal.
Right.
And
so I know that, Sheriff, we've been working on and talking about and trying to plan. We've had this mental health expo where we're doing another roundtable here where we're spending a lot of time talking about and thinking about what to do. What do you guys see in the Sheriff's Office?
Well, we're seeing a lot of the same things. Houma Police Department, we work very close hand in hand to a lot of issues that sometimes bleed over to the parish and sometimes bleed over to the city.
Right.
So we're seeing a lot of and a lot of things is people come to us for help,
Right.
and we try to plug them into every single resource. But I think the month and bringing it out, these are a lot of resources because sometimes people have their loved ones that have mental and they're trying to get the help. Is plugging into the right direction, and we want to help them. So the more resources available and the better we can educate the public, that's the best thing we can do.
Yeah, and it's one of those things, talking about educating everybody else is one of those things we have to do to educate ourselves. And we're going to talk a little bit about this walk-in campaign. We're going to talk a little bit about the walk-in clinics. But one of the things I'm really proud of is the CIT training, the crisis intervention training that you guys send all of your new people to, all of the new people that come in, and for retraining, right? So y'all send a lot of those people through law enforcement. I've been so very glad to be a part of that and helping people understand what schizophrenia looks like as compared to what dementia looks like. What does it look like when people present differently? And we're going to talk to the clinicians a little bit later about what they see. But I love the fact that those the people coming into your departments are being well trained on that. What's been the results and the improvement that they've seen? Travis?
yeah, CIT, whenever that started, I recall going to it a long time ago.
Right.
But we go way beyond that, and it's not just the police department; it's the sheriff's department, it's
Right.
all agencies.
Right.
CIT is a good thing, but we also have trained crisis negotiators, that work with our tactical team. Because a lot of times when people see our tactical team out and we're dealing with someone that's in mental crisis, that's not necessarily what our SWAT team's doing as much as what our trained negotiators are doing.
Our tactical
Because
team.
our tactical team a lot of times is just providing a safe environment for our negotiators.
Right.
Because if we have somebody that's talking, we're very patient. And as long as they're talking, we're going to work with them.
Right.
And that's what we're getting back through CIT and crisis negotiations. I don't want to speak for the sheriff, but his agency's doing a great job as well.
Right. Tim, I'll let you address that.
And look, a lot of the training, I was the director of the police academy for many years.
Right.
There's a lot of new extensive training for our brand new law enforcement officers in dealing with these things. And I'll throw a prop at Travis. I was a SWAT commander for Terrebonne for many years. And there's a lot of team. He was a negotiator, and we were kind of standing next to one another, listening to what's going on, directing the teams the best way to deal with it. And at the end of the day, when we had to deal with these type of crises, we wanted it very peaceful. without incident. And that was always been our goal every day, because sometimes it's a very touchy situations. And he was right about there's a lot of them that are self-medicating.
Right.
And that's
right.
think how they deal with it. And
Right.
we can recognize those things. And that's asking family members when they're out there getting information about him. Okay, well, you know what? He's not on his meds, and he's been doing this and doing that. And that's important information to us, for us to know exactly what we're dealing with. But I mean, we've been working hand in hand with a lot of these issues, but I think the forefront over the last 4 or 5 years, there's a lot more training for the brand new officers, even at the academy setting, on dealing with these type of situations. So, and I think all in all, it's helping for our younger officers, not as well as seasoned officers. We learn from experience of dealing with it.
Right.
But now there's just that big forefront of education. So now they can recognize it and we can better deal with it.
Well, I will give kudos to both of you. I'm very glad that both of you come on the show very often when we're able to talk about situations that don't become big news stories because of the strategic and the tactical way that you guys can handle and de-escalate situations. And we use those clinical terms about de-escalation and what we do for people, but those are very, very important. Both the Sheriff's Office and HPD do a great job in helping with that. It's one of the ways that we're dealing with this crisis. So we're very thankful that the excellent training is there and that you bring so many years, both of you bring so many years to both of your teams about how we do that and do it well. So thank you for that. We appreciate it. Talking about some of the ways that we do this, and you guys were just talking before during the break about how very often y'all partner together. Y'all have had multiple situations where y'all have kind of helped each other. Specific situation, Travis, where y'all kind of work together.
Oh yeah, recently, just since I've been there, we've had incidents that went out into the parish, and the parish, meaning the sheriff's department, will come into the city, and our teams will deploy because it doesn't matter
Right.
where it's at. We're going, and we're going to offer each other the help. But what's good is the training that we're all getting is the same training. So we can take our guys and put them working with the sheriff's department. The sheriff's department can take his guys and he can put them working with our guys, and you don't even miss a beat because the training is consistent and the goal is the same.
Right.
And that's peaceful, because all we want to do is give that person the opportunity to make a decision for themselves.
A peaceful outcome. And quite frankly, people only see or want to deal with or experience what all of the drama that goes with it. But there's all the training on the front end. There's the ability, like you talked about, Tim, Sheriff, de-escalating a situation. You gave another example of de-escalating a situation. And then even if there's got to be an arrest, there still needs to be follow-up, right?
Absolutely. I mean, a lot of cases like we were talking, sometimes they think it's the end of the world. And, sometimes we're talking to the families in the back while this is going on. And it's like, okay, we're going to get control of this. But at this point in time, these resources, and now it's time to focus on getting the help he needs and directing the help, navigating through the judicial system.
Right.
And then turn around and having a plan to get the help he needs in the process. And it's very important to that point. And, like I tell everybody, I said, these are all our citizens of Terrebonne Parish, and I want them to be productive,
Right.
and I want them to be happy.
And we don't want them in jail. We want to be able to handle what we need to do through the judicial system, but we also want to turn it over to people like Tim and like Brandy, who kind of help provide those kinds of services. Tim, you've done this for a long time, of course, with Test Action Clinic. Very glad that you're there. We've worked together over the years. What are you seeing? I mean, you very often get some of these people and help manage them, and you are, as a nurse practitioner, able to really handle both sides of that, the therapy side and the medication side.
Yeah, definitely. I mean, we definitely see, over the years, I've been doing this about 30 years now.
Right.
And you've definitely seen a progression, but it's always been a shortage of providers, So now we're getting a lot more community involvement together, get all the different agencies to work together. To hopefully prevent from even having law enforcement involvement. I mean, that,
Right.
that has to happen in some cases, unfortunately,
Right.
but the idea is to get, that proactive preventative stuff, in place. So we can get enough providers to have people to have access to care so they don't start self-medicating or
Right.
end up if interaction with the legal system. It's to have that availability. And I think, as a community, we're starting to work together at the expo today and, things coming up. I think that we're always trying to work together to do those things.
Yeah, and I will agree with you. I think that for the first time in a long time, since we've kind of lost hospital beds,
Yeah.
and so fortunately we're able to maybe see some of these things. It's much like what they do in law enforcement, a lot of data gathering. You guys do the same thing, a great deal of data gathering, looking at that history and seeing what we can prevent. So a lot of times before even law enforcement gets involved, you guys are being able, so both Brandy and Tim, y'all are seeing them in the clinical setting, and we're trying to prevent that from ever becoming a situation that escalates.
Yes, we're so glad to have the law enforcement we need.
Oh,
them.
God, yeah. And
But,
we
you
need
know,
them.
Yeah, oh, definitely, most definitely. But the whole idea is the preventative stuff. Because we have lost those beds, we've lost a lot of the acute care. So we're having to try and prevent from ever getting to that case. And yeah.
Yeah. So no, listen, I agree with you, and it's one of those things where I love these partnerships. And so y'all were all laughing at me earlier about being excited about Mental Health Awareness Month here in May. I'm excited because I brag all the time about parishes that work well together. I love the fact that the sheriff and the chief can brag about being able to just take a negotiator from this team, put it on this team, and it's seamless. I love the fact that they can identify this issue, handle it legally when they need to, and now plug it into all of our different organizations, Start Corporation, to over at what you guys do at Tesh Action, being able what they do at South Central, all of these awareness, and that's what the expo was about.
Yes.
Being able to find out what are some of these resources, how do we help these people, and how do we do that on the front end? We've done help lines very often. We've done a really good job with being able to have people call when they need it. But as we know as clinicians, people aren't always ready and willing to just make that call. They're not always wanting to just step up. They're not always able to have the awareness. It's interesting. We're talking about mental health awareness, and to be able to start that process. They're not sure where to start. And so I'm really excited because Brandy, in this next section here, just for a minute, introduce to us this new program that y'all are doing, because y'all have a walk-in center now. Introduce it. We'll take a break and then we'll talk a lot more about it.
Okay. So we do. We have a behavioral health crisis walk-in center where you can come in without an appointment. You have a licensed counselor on staff, peer support specialists, case managers that can meet with you and meet you where you are and figure out what are your next steps. We work in conjunction with law enforcement, and we're working on trying to get a seamless process where we can go out to those community members, we can have them serviced in our office, as well as continued follow-up care and connection with services.
And so I love the fact that all of this comes from, and one of the things that we've learned therapeutically in all of our training, start where the client is. Law enforcement has to do that in a situation they see it. We have to do that. But there's so much more that we have to offer. And there's walk-in clinics, and we're going to do this walk-in campaign, talking about what we're doing for some of these mental health crises, these mental health issues, but we're making it now more about mental health awareness. And so, Lacey, Brandy, you were telling us a little bit more about how this came to be with this walk-in, where we want people to be able to have access, right? We want them to know that if there's a crisis, there's a situation they have, they can walk in, somebody can see them right away.
Right. And not, whenever we say crisis, we mean a variety of things.
Yeah. Crisis to them.
Crisis to them.
Right.
We meet that person where they are, and we help them go through whatever experiences they're having. If it's a real mental health emergency, yes, we will involve the right kind of care. But if it's just someone who's going through a difficult time and they need someone to talk to, we have support available. And getting into a regular counseling appointment at all the clinics around,
Right.
it takes time. But
Yes.
some people need it right now. So we have created this walk-in center with LDH so that people have that option to just walk in. They can also call us, and we'll go out to their home or their location, and we'll assess and try to de-escalate, like we said before. And we work in conjunction with the police department as needed, and we make sure that those people have referrals and connected with services that they prefer. So if they prefer to go somewhere else that's not with START, we'll coordinate with them on that. And we will also coordinate them with the many programs that we have available at our agency.
Yeah, and one of the ways that we do that is this 988. So Jen, put that flyer up if you don't mind. I want people to realize that people are in crisis. They can just dial 988. You don't have to dial 911. If you know that you're in crisis, dial 988. It's a suicide and crisis lifeline. And this is one of the ways that we're trying to help with mental health awareness, right?
Correct. And our agency is partnered with 988 and LDH, and the fact that if someone calls 988 and it's during our hours, they'll be patched through to us. They'll send us referrals so that we can follow up with that person, make sure that they're doing okay, make sure that they have the appointments that they need and the support they need to get to where they want to be. We also work in conjunction with the different Medicaid programs so that if someone has, whether they call 988, whether they call their Medicaid provider, we can, be connected that way.
Right. So lots of different options. We talked about it just a little bit. Jen, I want to put that other flyer up because I want people to realize that we want to go out into the community. And this idea that started with both the sheriff's office and with Chief Travis Terrio, where they talked about the fact that we need resources dealing with people in crisis and mental health issues. It became an idea about this new National Suicide and Crisis Lifeline. And our local mental health providers, healthcare professionals, and law enforcement agencies are partnering for this event where they're going to walk through the areas of our community with information, getting the word out about 988, as well as the local mental health providers and partners. And you can see the long list here. It's Tim can tell you we haven't always had this long list of resources available to people, but we're going to be out walking on the streets showing people about what the local behavioral health providers are and how to reach out through 988. So we're wanting to do that. It's one of the things that we're expecting that you out there in the community be aware of that we are wanting to make sure that people in the community know that law enforcement, HPD, and Terrebonne Parish Sheriff's Office, they're there to help. They want to be there to help you. And that's one of those things that we're excited about. And so, Chief Travis, I'm really excited that they came to you and talked with you about this idea about making sure that we can let people know about this mental health awareness. I'm glad HPD is involved.
Yeah, we're very excited, and I feel like it's really going to help out all officers on the road with all agencies. We hope it's something that is a growing trend.
Right.
And look forward to any future partnerships.
Right. And Sheriff, it's one of the things you and I talk about it quite a bit. All of your representatives do. Y'all are trying to, and I think making a huge effort in saying, hey, here we are. We're here to help. During the holiday times, we're here to have things for you.
Right.
When it's not the holidays, we want you to know we're here, we're present. Come and talk to us. We want to be that voice for those people that don't have one, and we want to hold people accountable when there's a need for that.
That's right. And look, this is about reaching out and putting resources out there and help them. We are here to help and educating that there is help for you and there is hope. And we just want to give them that hope.
Right. And get them connected, because quite frankly, y'all are very often the starting point for getting them connected. And Tim, for the years that you've been doing this, and now that you've been able to see this, kind of nice to be able to see that we've got these partnerships, right?
Yeah,
for a long time, we were just, we either see them or we put them in a hospital. And now we've got so many more resources to be able to help.
Yeah, we're definitely trying to prevent any inpatient if we can.
Right.
Cut it off early with some good early intervention.
Right.
Prevent that downfall.
Right. And so we're so very glad that Tesh Action's a part of that and helping with that and what you do every day. And really excited about the efforts that have been made, Brandy, about what y'all are doing to say, you know what? People sometimes need to just walk in, and we need to have a system available for that. People sometimes just feel like they need to call. 988 is a system for that. And now we're going to be out doing this kind of walk to let people know. Kind of excited about the programs that are coming up, right?
Absolutely. They can call 988. They can all call us directly. Like Tim said, just getting connected. We have not just these programs, but we also have a veteran suicide prevention program. And we have just a multitude of services that we're, ready and willing as long as that person's ready to accept that help.
Well, we here at HTV are very, very glad that you are all involved about what we're going to do, about identifying this need. We know there's a need. And we know that a lot of these crisis situations have a great deal of mental health issues, and the mental health awareness and making sure people are aware of what to do, how to do it, and how easy that is. We want to let people know it's easy. If you want to make the call, make the call. If you want to go walk in, you can walk in. Or if you want to reach out to any of our friends through law enforcement with HPD and Terrebonne Parish Sheriff's Office, they're there as well. Thank y'all for being here, and thank y'all for helping us with this. We appreciate it.
Thanks
All
for
right.
having us.
And that will do it for this particular segment of Bayou Time. Don't go anywhere. A lot more local programming right here on HTV.